within one procedure was able to go back to work, was able to help around the house. Obviously, because of this, his mood improved dramatically. Just changed his life.
Welcome to the Clear Health Podcast. I'm your host, Dr. Tom Roundtree, and this is where we discuss the intersection of life and medicine. Well, welcome, Dr. Ding, to the podcast. Really great to have you here. How's your morning going?
Going wonderful. Great to be here.
Good.
Thanks for
Pretty
having me.
busy?
Yes, very.
Yeah, that's right. So I know I kind of wanted to start out because I felt this was an interesting part of your past. You said that you were a TA at Purdue, and I think that's really important because it gives you a good kind of teaching background. And this was before you went to chiropractic school. Is that right?
Correct. Yep. In undergrad. Yep.
And so what was it like being a TA there?
It was interesting. A lot of fun. Met a lot of great people, great students. It was exciting, honestly. I taught for a human anatomy and physiology course, which was part of the prerequisites for nursing school. And then I also taught a biomechanics course, which is for the major of movement and sports science, exercise physiology, essentially. So I did both of those. I had some fantastic professors to rely on, and it was quite an experience. It definitely fueled my passion for educating patients, educating friends when they decide they want to ask for it. So it was a lot of fun. I really enjoyed it. It definitely, like I say, it fueled my passion for educating others.
Oh, good. And so this was at your, if I understood, at your undergrad?
Yes, at my undergrad level.
Okay, and then, and what degree were you pursuing, or what degree did you get? Maybe they're different. I don't know.
Yeah, it's a degree in biomechanics.
Okay.
Yep,
Okay. Nice.
Yes.
So that kind of set you up maybe to go and pursue a further like higher education in chiropractic care. Is that right?
Yeah, that I think was always the goal for me. Even at an early age in high school, my mom was a nurse for a cardiologist. So even at an early age, I was kind of, with my mom being a nurse on top of it, I was sort of led in that direction towards the healthcare field in some way or another. So yeah, it kind of helped me, kind of push me into that direction for sure.
Yeah, nurses are really special. They're the cornerstone of our healthcare. Like
I married one as well, so.
Oh, well, there you go. She probably keeps you in check.
Absolutely.
Just like my wife does. Yeah.
My wife is a psych nurse, actually. She has been for her entire career, 24 years. So she really keeps me in check.
Yeah, there's literally no arguing with that.
So you've been to my house, obviously.
Oh yeah. I've shadowed some psych individuals. So that's really cool. So, and then afterwards, you went to chiropractic school. Is that correct?
Correct. Yes, I went from Purdue undergrad, received my undergraduate degree, and then right into chiropractic school in South Carolina.
Oh, nice. Yeah, South Carolina. That's kind of a beautiful area.
Absolutely. If you like golf, especially.
Yeah. There is a lot of golf there. That's where my my mom and in-laws live. So, it's a nice area.
Yeah. It is.
And what was it like going to chiropractic school? Because I'm actually interested in that kind of aspect actually.
So it was intense at first. The days, in the first few trimesters were very long. It included human anatomy course, obviously cadaver lab, they call it. So there were some very, very long hours. There was so much information, I think, that it was a difficult transition from undergraduate where, you as a junior and senior, you kind of had developed your game plan for studying and doing well. And it wasn't nearly as intense as as chiropractic school. So it was at first it was a shock, right, to the system to get used to that and develop your own plan. A lot of long hours, but um, once you started getting the hang of it, it was fantastic. It was very very interesting. I find the human body and how it works fascinating. Always have. So um, it was absolutely fantastic. Met a lot of great people there, and um, certainly was certainly surrounded by people, obviously of like mind, and our passion kind of just grew together from each other. Even so, in what we were doing and how we were going about it.
Did you find that the town kind of respected people from the school around there, or was it? Because I know it depends on the size of the town sometimes, but did you find that as well? Like, because I found that when I went to med school, they would say, "Hi, you go to the med school" and stuff like that.
Yeah, I definitely think that the people in town were happy to have us there. At least that's the experience I had. Um, they were afforded care at an incredibly reasonable rate. So that
Mm-hmm.
was really, really nice for them. So yeah, I think there was a warm greeting, so to speak, from the townspeople in Spartanburg that they were appreciative of us being there, and we certainly saw that they were respectful of it.
Mm-hmm. Mm-hmm. And you said that they got treatment there too.
Oh, absolutely, absolutely. We had a intern lab, if you will, a hospital, so to speak. And so patients were, townsfolk were allowed to come in and get treated. We were It was by upper quarter students that were, in their last few trimesters, and they were always guided by a licensed chiropractor the entire way through. So it was pretty interesting.
Oh, that's good. That's good. And I assume you still have friends from your school. Is that right?
Oh, absolutely, absolutely. To this day, yep. I've got some very close friends, all spread out all over the country in practice.
Good, good, good. Um, and so after chiropractic school, you kind of went. Did you join like a corporation, or were you with a certain group?
So, right after school, I actually, at the time, was married to another chiropractor, and we opened practice together right off the bat. She actually worked for another chiropractor, did an externship for about 6 months or so, and then we jumped in with both feet, so to speak, and decided to open the doors on a new practice right from scratch in Howell, Michigan.
Oh, nice. Oh, interesting. Okay, okay. You said Howell, Michigan.
Yes.
Oh,
Yep.
okay, nice. Um, and I know that. Did you have a certain, or did you form kind of an interest for a certain aspect of chiropractic care? Like, in other words, maybe focusing on more like a sports area, or stuff like that.
Yeah, I think that was it was just sort of natural for me to go right into that sports and slash performance avenue of care. Um, I was an athlete my entire life. Huge sports fan. Baseball, bat, all of them. And so I think it was just natural for me to sort of go into that arena in sports and performance care. Absolutely. So that was definitely the
Yeah.
direction I headed from the beginning.
Oh, good, good, good. So there's kind of a little bit of a vision, kind of where you wanted to end up almost.
Certainly. Certainly.
And did you play sports when you're younger?
I did. I did. Mostly soccer. It was sort of the passion of mine, but baseball and football as well. But soccer was really where my heart was at, for sure.
Oh, good,
Um,
good. It's a fun sport. I broke one of my big toes playing it. Yeah, it was
yeah,
really
it is.
good.
It's a great sport. Doesn't have as much popularity here in the U.S. as it does abroad, but it's growing for certain. Some of the international stars have been infiltrating the American MLS league, so it's certainly
Hmm.
growing for sure.
Yeah, I remember in Texas where I grew up. There's a big Mexican population, and so they like the older gentlemen would be out there, and they would just be killing it out there, and they would end up with sprained ankles and, broken bones, and
Yeah,
they would get healed and they'd be like, well, I guess it's time to go back and do it
absolutely.
again.
It's very intense
Um,
passion for soccer.
yes.
Absolutely.
Yeah. 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 And the games were just as wild, right?
Oh yeah,
Throwing
very
water, getting
intense.
water thrown on your head, and all that stuff.
Yeah, very intense.
Um, but I know that you had told me that you want to visit all of the MLB parks in the U.S.
Yes. So, a- as much as I loved soccer, when I was younger, I did play baseball, loved it. My passion for baseball grew as I grew older. I actually have retired now, but even as recently as a couple of years ago, in my late 40s, I was playing in the men's Detroit League, in
Oh
hardball
wow,
baseball. So, just love the sport. We're a baseball family. All of our boys, all four of our boys, play baseball or have played baseball. The older ones are in college now, but so yeah, it's always been a big passion of ours. And so my wife and I started this quest to visit every major league park. All right, so I was ahead of her by by a good 8 to 10 parks that we had to revisit because she hadn't
yeah,
visited
yeah,
them yet.
yeah,
It's
yeah, yeah.
but we're doing well. We're probably about 40% of the way there now on our
Oh,
quest to
cool.
visit every park. So it's a lot of
That's
fun.
fantastic.
We take a vacation or two each year, and especially in the summertime, obviously, and visit a couple parks at least every year.
Oh, good, 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 good. And I know on your website you actually have the Notre Dame. You had a Notre Dame baseball pitcher, David Lally Jr.
Junior. Yep. Yep.
Is that
So
right?
yes, he's since entered the portal and actually now has transferred. He's actually at University of Michigan.
Oh,
So
wow.
he's
Okay.
yeah, he's local to us now, so which is pretty cool.
Oh,
Yep.
nice,
So
nice. And
yep,
he was one
he's
of your patients. Is that right?
correct. Correct. Yep. He's a great kid.
Very nice.
Throws throws some serious heat. He's hits 97, tops out at 97, 98. So
Really?
he's
Wow.
yeah, he's I think he was drafted in the fourth round. But at that point he had decided that he was going to school for certain, and I think that was probably why he dropped as far as he did, but he's incredibly talented. Yeah, he's a great young man.
Mm-hmm.
Good head and shoulders on top of it.
Good. Good. You need that. You need that when you're
Yes.
popular.
Absolutely.
um. So, what do you find like when somebody's playing baseball? Do you find certain injuries that are kind of repetitive, or certain wear and tear that they come into your office with?
Yeah, absolutely. I mean, one of the biggest is, forearm strains, and potentially elbow ligament damage. Another one with some of the older baseball athletes, if you will, you find a lot of adhesive capsulitis, um,
Mm-hmm.
as
Mm-hmm.
well, which we perform MUAs on with some fantastic results.
Yeah, yeah, that was I was getting to that actually. So which is really cool. So I think you said MUA, which is manipulation under anesthesia, right?
Mhm. Yes.
And it's a very cool thing because a lot of times when somebody comes into my office with adhesive capsulitis or commonly called frozen shoulder, I can only go so far, right? And
Yes.
I have to have them back a lot of times sometimes to keep manipulating it and fix it. And but you take it one step extra, which is kind of cool. You manipulate it under anesthesia. And
Yes.
can you tell me, like, do you have a story around that kind of maybe changed a patient's life?
Oh, absolutely. So I had a patient. This is probably a good, probably 7, 8, 9 years ago. I was practicing in Flint and had a patient that had been in a car accident. Um, and he had tried every sort of procedure known to man, with zero results. The only thing he hadn't done at that point was surgery. And just sort of at his wits' end, kind of went into a depressive state, and was just miserable. Could not function, anything close to where he was before the accident. Um,
Mm,
he came in. treated with us for a while. After, I want to say, it's probably about a 4 month period of treatment, had seen some positive results, some permanent change, just not enough. And so I suggested to him that maybe we try an MUA, and see if that was something that might help him. And it was life changing for him. I mean, he within one procedure was able to go back to work, was able to help around the house. Obviously, because of this, his mood improved dramatically. I mean, just changed his life. And
Mm-hmm.
the company that I work for actually did a YouTube video and put it up on the YouTube, um, where he describes his situation, what he had gone through, and how this had completely changed his life. Yeah, it's
Oh,
pretty amazing. It
wow.
was pretty amazing to watch somebody go through that, um, that kind of adversity, and one simple procedure turned his life around completely.
Yeah, yeah, yeah. And I seen it where I've seen both things where you manipulate under anesthesia, and I've seen the arthroscopic version of it where they go in there and they kind of shave the shoulder a little bit and they cut the adhesions, on there. So it got me thinking about, well, what's kind of the best way to maybe handle it, or what's the most maybe cost effective? And I found a really cool study called the UK Frost, like frozen shoulder frost.
Hmm.
And it was a multi-center randomized trial. There's like 914 people, and they compared regular physiotherapy with manipulation under anesthesia, as well as the arthroscopic, like the orthopedic surgeon coming in. And the MUA, the manipulation under anesthesia, had the highest probability of being most cost effective. And I was like, oh, wow, that's really cool. So it was a really robust study that found that if you're doing manipulation under anesthesia, that probably saves the patient the most money. And they probably don't, one, they don't have to keep coming back to the office all the time. And two, they're not paying for the orthopedic cost of like the arthroscopy and the tools and all that
Correct.
stuff.
Correct.
And I think you told me you told me a little bit about this when I was talking to you before.
Yeah. So the MUA procedure is, people like to think that it's new, but it's actually been around for close to about 100 years now. It was something that was performed by osteopaths and orthopedic docs back in the 30s. It gained some popularity, and I think that popularity started to die off for a couple different reasons. I think the general anesthesia was a little much maybe for that level of procedure. I think was probably
Mm-hmm.
something that helped that decline, and then the invention of advancements in surgical procedures obviously made a huge improvement in that, and pharmaceuticals as well. And that was a route that was obviously became more popular. But then back in the 1990s, I think it gained popularity again with chiropractors. I mean, obviously we are the manipulation experts, if you will. So I think
Mm-hmm.
it gained some popularity with maybe some more traumatic cases, that weren't responding the way that we'd hope they would respond with traditional, in-office care. So I think that was part of the reason as to why it started gaining some popularity, to be used again. And again, the cost effectiveness, like you say, like you mentioned in that study, is a huge factor, right? One or two procedures, they don't even come close to the cost in time or financial, to some of the other options.
Mm-hmm. Mm-hmm. Yeah, yeah, definitely. Can you walk us through that type of procedure?
Yeah, absolutely. So as far as our perspective, it's similar to other procedures that you would have any sort of anesthesia for. There's an anesthesiologist on site, potentially a CRNA as well, nursing staff. So they're getting the patient prepped and ready for the procedure. As far as from our perspective, doing the procedure, the docs that come in, it's depending on how many areas that we're doing, it's roughly a 15 to 20-minute procedure. And there's protocols for obviously every single area that you do, whether it's a knee, a shoulder, the spine, hips, what have you. But there's a routine that we go through. There's a lot of intense stretching and seeing what patient's actual true range of motion is versus what they can do when they're awake and pain starts to stop their range of motion. Um, and again, while it's called manipulation under anesthesia, a large majority, probably 80 to 85% of the actual procedure involves intense stretching, trying to break up tissue adhesions, whether they're in the joint, muscular, what have you. So there's a lot of stretching, a lot of intense massage by the doctor, then eventually the manipulation of the whatever joint or joints we may be doing that day.
And I think it may be important to describe on the inside what an adhesion kind of looks like. And to me, when I would see it in the camera, it looks kind of like a Spider-Man spider web. It's kind
I
of
think
like
that's a perfect
connected.
description.
Yeah, it's like connected on there. And because you think adhesion, like, is it like a flat thing? No, it looks like Spider-Man spider webs. Like he just went in there and just, went to town. And, you know, and so that's what's stopping them moving that kind of range of motion there. And I think, am I right? It's full anesthesia, right? Like it's not like a twilight level. It's I think it's pretty deep, isn't it?
No, actually, I think that was sort of what they were using, a while back for the
Mm-hmm.
procedure. But now it's more of, I think the most common uh, anesthetizing agent is propofol, is what they're using.
Mm-hmm.
So it is
Mm-hmm.
more of a twilight state sedation. There's um, quite often my patients under that particular anesthesia will moan a little bit. They'll even say a couple of nonsensical words at times, even move a little bit or resist us. So that's when the anesthesia professional obviously will administer a little bit more to put them into a deeper sleep.
Yeah, yeah. The same thing happens during a colonoscopy. Go figure. I don't know. um, so, um, can you? I know on your website you have other things that you offer too. Like you offer the joint pain assessment and treatment, and you have stem wave regenerative therapy. Can you talk a little bit
Yes.
about that?
Yeah. So stem wave and shock wave both are sort of newer technologies. It's a focused shock wave, essentially what it is. And to break it down into layman's terms, it's imagine like a miniaturized lithotripsy machine is essentially
Mm-hmm.
sort of what we're dealing with. And so you're penetrating deeper into tissue. So when they say regenerative, it helps stem cells become more active in that area. So you're not adding stem cells or producing stem cells, obviously, but you're helping that process move along. And so the results have been fantastic. A massive reduction in inflammation in joint areas and muscle tissue in one treatment. Um, I, I believe the company states a 91% reduction. I haven't read the study myself to see the
Mm-hmm.
particulars on it, but that is what they claim. So yeah, we've had some fantastic results with it, though.
And if I remember, it's kind of like is it like you're using an ultrasound probe looking thing?
Very similar, yes, very similar. When you hold a device, it almost looks like a microphone, if you will,
Okay.
and it's administered for just about a 5 to 8 minute period on a particular joint area that the patient might be having a problem with. So the treatment is fairly quick, but it has some fantastic results.
Oh, good, good, good. And another interesting thing you had was an orthopedic telehealth consult. Is that right?
Yes, so we utilize something called MDT, Mechanical Diagnosis and Treatment. It's part of McKenzie method. Robin McKenzie was a physiotherapist from the New Zealand area who developed this particular method quite a few decades ago. And so it allows the practitioner who's certified in the procedure to evaluate and assess patients based on their motion. And in doing so, you find what they call a directional preference for the patient. And repeated motion in that directional preference winds up essentially getting rid of pain and helping that person move better, have better mobility, and then as well as giving them the tools, to help themselves into the future. He even has a couple of books produced, paperback books, pretty thin books, but pretty profound. How to treat your neck and how to treat your back. Giving the patients the tools to help themselves into the future.
Yeah, it's interesting. You say the thin books. Usually, people who are experts can say a lot more with a lot less. That's what it is.
Yeah,
Um,
choose your words wisely.
yeah, exactly. Yeah, the McKinsey method. I looked it up a few years ago, actually, and it's actually one of the most proven methods for back pain treatment. I know a lot of patients that I had coming through my office at the time. I would send them to get this McKinsey method, treatment, and they would say that it worked extremely well. And so, I'm really glad to hear that you use it, because it's actually very well proven, and actually works really well. Um,
It does. The results are amazing.
and so I know uh, you've been practicing for a while, and given the flow of the chiropractic industry, and initially you had said that you started out with an insurance based practice. Is that right?
Correct. I did.
And now you're kind of you're a little bit of a rebel.
Yeah, I don't know about that. I don't know about Rebel. I think cash-based practices are certainly they're not the norm in chiropractic, but they're certainly growing in popularity. And cash practices have been around for quite a while. And I think, especially in this profession, insurance wasn't always something that was even an option for chiropractors. They didn't, a lot of insurances didn't even cover chiropractic care.
Yeah.
So I think cash was sort of the only option at that point. So, but yeah, it's again, I don't know if I want to say rebel, but it's certainly not the norm yet.
Yes. Yeah. Yeah. And yeah, because I remember when insurance did not pay for chiropractic care. And then it's been a few years since I, looked at chiropractic care, and I met you, and I was like, oh, that's interesting. They're kind of going through the same revolution that primary care doctors are. That we're saying that, oh, well, insurance is not congruent with our principles to treat patients. And not only that, but it significantly interferes with our own ability to cognitively handle the medical problem load and the interaction with patients. So did you find that kind of same thing where the insurance would just interfere with your treatment and daily activities?
Yeah, I'd say so. I'd say so. I think physicians start to see that the patient and themselves are no longer in charge of patient care. When the doctor's
Mm-hmm.
worried about what he is or is not able to do based on the patient's finances, right? So then, you know, not directly, but indirectly, the insurance company is now dictating what kind of care a patient will get, right? And at the end of the day, physicians that own their own practice are worried about their bottom line, and are they able to treat patients and actually make a profit and have a living? So you combine that with the squeeze of the insurance company, what they will and will not allow. I think doctors wind up and patients both wind up um, getting underserved because of that, because of the, not really being in actual control of their own care.
Mm-hmm. Mm-hmm. Yeah. And the other thing is that we have to hire more people to handle the insurance itself. So then your
Absolutely.
overhead gets massive. I mean, for me, I would have to hire like 3 people extra if I took insurance. Um, and so it's definitely something that needs to change. I mean, at least
Absolutely.
I think so.
Absolutely. There's a lot of
Um,
hoops that you have to jump through to even bill insurance. So yeah, hiring a lot of staff is an absolute necessity.
yeah, Yeah. Um, so and now you don't take insurance at all in this current practice. Is that right?
Correct.
Okay. Um, so and how does that feel now to you?
So, I mean, there are pros and cons for certain. Initially, I think I mean, you come from an insurance-based practice for the last 20 plus years. There's going to be some fear, absolutely. Is this going to be something that's accepted? So I think that's the first sensation that you get, the first emotion you get
Mm-hmm.
is fear of the unknown and what it's going to be like. But we've pushed ahead and fought and we're growing. And we're definitely patients are more accepting, and I think they're more understanding of you know the fact that it requires some intervention on their part, essentially, if you will, to maintain good health.
Yeah. Yeah. And since you started this kind of new endeavor, has your family life changed at all?
Yes, I'd say to be anything, it's moved in a positive direction. Um, I think I'm just less stressed. Um, just a happier person to be around. I think my patients can see that as well. Patients that have followed me from an old practice, to here. I think that I'm just able to deliver and focus on patient care more so than I ever have been because of that.
Mm-hmm.
Because I know that I'm able to concern myself 100% with that patient's case and what they need and deliver that care without any concerns or worries about insurance or what the patient can afford, because their insurance isn't going to pay or something along those lines, or racking up a large bill or anything like that.
Yeah, and the patient, I assume they know the cost, so they're at a little bit more comfortable level too, because they don't get
Absolutely.
any surprise bills afterwards.
Absolutely. I think that's a huge part for the patient is just up front, hear the cost, and they know walking in before they even step foot into our office if they want to find out what they are going to be expected to pay.
Mm-hmm, mm-hmm. Yeah, that transparency, I mean, is key, and it just seems like it would be something natural in the healthcare industry, but transparency isn't always there, because you have this obscurity of the insurance, in the background there.
Absolutely.
Um,
It's the man behind the wall.
and
You don't know
what's
what's going
that?
on.
Yeah,
And it says
yeah,
like the
you
man
you
behind the wall, you're not really sure what's going on.
yeah, exactly, like the Wizard of Oz, like the wizard's
Exactly.
behind the cape there, the and you're like, who is that guy? And he never comes out. Um, and you said that you were, going back a little bit, you were chief of staff of chiropractic at a large hospital, which is interesting. I've never heard that myself. Can you kind of talk about that a little bit and what you did there?
Yeah. So Insight is the company that I used to work for. It's started out as a neurosurgery group based out of Flint, and in the last, I want to say, 5 to 6 years, they've acquired several hospitals and grown their practice from neurosurgery into essentially just about every specialty you can think of. And approximately, I want to say it was the end of 2015, beginning of 2016, they hired me to run their chiropractic, physical therapy, and occupational therapy department and the Flint office. And then at that point, we grew and acquired several different hospitals. One in Warren. There's a surgical hospital in Warren. They have a large outpatient clinic in Dearborn. A couple of years ago, I want to say 3 years ago, they purchased what used to be Mercy Hospital on the south side of Chicago. Um, and since then, they've also purchased a hospital in, I believe it's Keokuk, Iowa.
Mm,
And I think recently they were trying to buy a hospital in Los Angeles as well. So after all the purchases of those hospitals, each time they did, they would open up every department that they had in the Flint office, which included chiropractic, PT, and OT, orthopedic surgery, and so on. Um, and so we would open a department of chiro, PT, and OT in each one of those locations. It was my responsibility to staff and make sure that those departments are running well.
Oh, okay. Nice, nice. And you it sounds difficult. I mean, it sounds like there's a lot of
So,
responsibility there and a
it
lot of
was.
emails coming in.
There was there was a lot of work. I mean, it certainly cut out some patient treatment time, which was unfortunate, right? So I spent some time treating patients, but I spent a lot of time on administrative things, reviewing cases, obviously, of all the doctors that worked for me, speaking with all the individual managers of each location, um, discussing and fixing problems, watching, obviously, the financials for each location and how those were going. So, yeah, there's a lot of administrative work, not as much clinical as I would have liked.
Yeah, yeah. It seems like that, like as an organization gets bigger and you have that role, you lose a little bit of clinical contact there.
Yeah.
But now it's like I mean, I assume you have a lot more now.
Oh, absolutely. I mean, obviously owning your own practice, there's always going to be some administrative responsibilities, but it's not nearly what it used to be. And with just one location, most all of my time is focused on the patient care.
Yeah, yeah, yeah. And the name of your practice is Restorative Spine and Pain, and you're in Troy, Michigan, right?
Yes, yes, Troy.
um, and so I know we've talked a little bit about the change of the industry and things like that. Is there anything else that you think with the chiropractic industry that maybe needs to change a little bit, or maybe become more in touch with the current problems in today's world?
I would say absolutely. I would say probably one of the most important aspects, in my opinion, would be the need for the profession to come together to promote what it is that we do, right? I don't think there's a very congruent, unified voice in chiropractic to promote what it is that we do. And that, I think, leads us to where we are now with a lot of misconceptions about chiropractic care and a lack of understanding of what it is that we truly do. Um, when you when you let rumors and what have you, decide what the public thinks of you, you're doing yourself a disservice. So I think us coming together as a profession and promoting ourselves, just like dentists do, just like anybody else would do, right? Whether
Mm-hmm.
it's commercial marketing or what have you, um, just getting the word out on how important it is to just see regular checkups, right? To get your spine checked with some regularity and make sure that you're taking care of yourself and your mobility as you age. I think just like I say, a unified voice would be paramount to us promoting our profession and getting the correct word out, if you will.
Yeah, it sounds like that it's something that you might need to start.
Certainly possible. I can add that to my plate.
Yeah, it
Whatever
should
it
be easy,
takes.
right? To get
You would think.
everybody, get the
Yeah.
cats corralled together.
Yes, easy. That's the word I would use.
Yeah, yes. Yeah, we face that in the Direct Primary Care Association, that getting us all aligned on one topic it can be difficult, be extremely difficult. But yeah, I think getting people to know, what you do and your stories and things like that, I think it'd be very, very important. Um, and the other thing I was going to talk about was, in the osteopathic world, we have certain techniques that we do. Like we'll do like the HVLA, the high velocity, low amplitude, which is like the neck cracking and the back cracking, and some of that, to me, at least when I would do it before, um, it seemed to be almost like a psychological relief versus a mechanical relief, if that's making sense, or like a muscle manipulation relief.
Mhm.
Um, what are your thoughts on that?
So, um, I certainly think that there is something to be said about the psychosomatic factor, if you will, of the noise being heard by a patient, right? Oh, did that
Mm-hmm.
go? Did that move? As if the noise is the thing that tells us whether the joint is moved or not, which we know obviously is not true.
Mm-hmm.
So there's definitely a large part of that, and I think the response, the actual physical response that a patient may feel, can vary quite a bit based on that noise. Now, as far as that particular adjustment type of a manipulation, um, it has its place just like anything else. I would say, if to me, it's all about the correct diagnosis, right? Or
Mm-hmm.
if we've done a thorough assessment of that patient to determine what's appropriate, right? We have a ton of tools in our tool bag, in the chiropractic world that you can manipulate a joint with, and many of them don't produce that cavitation, that sound. So I think at the end of the day, it's just proper assessment and what is the best method for this patient to get the best possible outcome, and whether that is a high velocity, low amplitude manipulation, which potentially could include rotation or not is really just based on that good thorough assessment, right? For example, if I have a patient that comes in and they've got radicular symptoms into the arms and hands, and they've got some disc degeneration after X-ray, we see some disc degeneration in the cervical spine. The very last thing that I'm going to do is a high velocity, low amplitude rotary
Mm-hmm.
adjustment, right? We've got electric impulse tools that deliver very light force specific adjustments with no rotation. So there's a lot of options that we have. MDT, again, which is pretty much, for the most part, not completely, um, can be a hands-off uh, modality for us to use. So there's a lot of options that we have. So while that manipulation is certainly one of the tools in our tool bag, it certainly isn't the only one.
Yeah, that's good, and I think that that goes along with kind of exploring the chiropractic story, right? Like a lot of people think simply because on social media you'll see that cracking, everybody's cracking, right? And but I think there's a lot more to what you can do, like you were saying, and you said MDT. Can you expound on that just a little bit?
Yeah, the MDT, like we talked about before, is McKenzie method. It's mechanical diagnosis and treatment. Um,
Okay, okay.
and that, yeah, that's essentially what we were talking about before. At I think even the instructors that work for the McKenzie Institute will tell you that at its core, MDT is really just a fantastic assessment and analysis tool. So the therapy that comes afterwards, again, is excellent. Don't get me wrong. It gives patients the tools to correct their issues into the future, right? It gives them the power. Um, but at its core, that I think that is the most important part of McKenzie, is that an accurate diagnosis, an accurate assessment of what is going on with the patient.
Yeah, it's kind of like a step by step like method to analyze what's going on. Is that right?
Yeah, yep, it's very thorough, and you find, like I said, what we call a directional preference of the patient, and repetitive motions into that plane, um, quite often, very often, results in positive patient outcomes.
Hmm. And so now that you have more time with your family, what does a dad of four boys do to make sure they don't destroy everything?
Well, so three of our boys are a bit older. Two of them are at Michigan State. One's entering his last year, and then one's at Cleary College. So pros and
You
cons.
made it.
We see we see them mostly in the summertime, um,
Good.
and then when they need money, of course, we see them then. But then we
Mm-hmm.
have a 10-year-old
Mm-hmm.
as well. So you know, it's funny. You miss them when they're gone, and you're waiting for them to leave when they're here, sort of thing. Sometimes
Yeah,
we spend,
yeah.
when they're home for the summer, like now, we spend a lot of money on groceries, for sure, a lot more than normal. But no, again, we're a sports oriented family, so we're constantly outdoors, whether it's playing a pickup family game of basketball, volleyball, swimming, whatever it might be, going to see baseball games. We spend a ton of time outside and staying active. That's I think the key, and we spend a lot of time together. We enjoy each other's company a lot. It's fantastic.
Well, that's great. That's really great. I mean, that's what, as a family getting outside, there's nothing almost better. There's nothing than getting outside, enjoying the outdoors and moving, right?
Absolutely,
Um,
absolutely.
and
Um, there's a saying in the musculoskeletal world, whether it's physical therapy or chiro or somewhat of the same like, motion is medicine. It's actually part of a slogan that we have, and it's true. It really is. It is a form.
yeah, yeah, definitely. Yeah, there's a saying we have that also food is medicine,
Oh,
and
a hundred
I
percent.
think yeah, and I think they kind of go hand in hand, definitely there. Um, well, I know we're kind of getting to the end of our journey here, and I was wondering if there's anything else you wanted to talk about or anything else you wanted to mention.
I wouldn't mind diving into to that slogan that you just mentioned. The food is medicine. That
Yeah,
certainly.
yeah,
I
yeah.
mean, we could take a long time and talk about that.
Yes, yeah, I think so. I think so.
Yeah.
Yeah, go ahead. Let's talk for a few minutes on it.
So, um, I think you had even mentioned, in an email about, U.S. food industry and some of the things that they maybe have been a policy or something that they've been letting the public know is good for them or, what have you, over the last couple of decades. And if you look at like the food pyramid, right, that's awfully scary to look at, right? You look at the bottom of the pyramid and breads and grains and pastas, are the largest part of that pyramid, and it's kind of terrifying, to be quite honest, that we're consuming that kind of level of grain. Um, even 80 years ago, 90 years ago, whenever it was, that grains were not over and sprayed with incredible amount of chemicals, herbicides, pesticides, and what have you. I don't know that was an appropriate thing for us to be consuming on such a large quantity. So I'd love to know your thoughts on that.
Yeah, yeah, it's true. I think a very interesting thing is one of my family members used to have a farm, and we used to run from the plane. Like we'd be getting groceries out of the car, and we'd see the plane coming to spray, and we like, okay, let's go, get out of here. But yeah, I think the food pyramid. There's a few things. One that the concentration of the grains and breads at the bottom, I think that needs to be reversed a little bit. Definitely taken down, a few notches. And the other thing is that the what a lot of people don't know is that corporations have the ability to input into this food pyramid. So if you look at the Canadian guidelines versus the American guidelines, they're very different. Canadian shows just a small portion of bread with a bunch of vegetables on the plate and a bunch of fruit and a little bit of meat up over here. And, and the American diet does not. The
No,
recommendations do not. They don't show that. So I think that it's good to know that that is not, at least what we know from the American College of Lifestyle Medicine, that that's not a very healthy diet, and they call it sometimes the SAD diet or the standard American diet. I think it's not good where it currently is.
no, absolutely, absolutely not. And I don't even know that many people even know what the recommendations are, right?
Mm-hmm.
I think maybe a bigger concern is what passes for food these days. I mean, I hate to use the quotes, right? But what what passes for food is alarming. You start reading ingredient labels, and it's scary what we're putting inside of ourselves, to be honest, especially our children.
Yeah, it is. And the other thing is that it's sometimes it's very difficult to keep your child from noticing these things in the grocery store because they use our ancestral response to bright colors for danger. And so then the child will look at it and they'll be like, oh, I want that, and you have to constantly remind them this is not good.
Right.
Vegetables and fruit are what's good, over there.
It's a that's a very tough task, very tough.
Mm-hmm.
Yeah,
Yeah. Yeah. Our
constant
our
battle.
4-year-old finds them out, you know.
Yes, they have a great habit of that.
Mm-hmm. Mm-hmm. Um, the other thing is that very interesting when you look at Japan, as soon as they get into school, they have a nutritionist right there. And that nutritionist is teaching them that, oh, what is it that, what should we be eating? And when the kids get surveyed and they get polled, they will say, like, what's your favorite food? And they'll be like, broccoli. Broccoli's my favorite food. And even though when they ask the question repetitively, the kid will stick to his guns and be like, broccoli, you know.
I think
It's
you
not
might have
free.
to.
It's not Frito Lay's.
No, you might have to search long and hard to find an American child whose favorite food was broccoli.
Mm-hmm. Mm-hmm. Yeah. Yeah. Do you ever talk to your patients about this type of, food problem?
Absolutely. Patients are always recommending or asking for recommendations for what they should be eating. Um, it's pretty consistent that they do that. So, my advice to most of them is to consume a lot of organic fruits and vegetables. Make that pretty much the staple, of your diet. Um, Avoid, heavy grain use, heavy dairy use, lean organic meats, and in smaller portions are fine as well. And that is a decent summary of most of the advice that I give them. But yeah, the patients are usually asking for what what to eat. They're just not sure. I mean, with so many fad diets and whatever,
Mm-hmm.
they're being bombarded consistently with that stuff. So it's hard to get some actual good information.
Yeah. Yeah. It is. It's very hard because they're looking at all of these different things when it's, I mean, and from our point of view, it's very simple. Does it look like a whole food or doesn't it? And it's kind of funny because the Mediterranean diet is one of them that seems like a fad diet, but it's just simply our whole foods and our vegetables and our fruits. Um, and it's very hard to show them the proof of it when they're bombarded by all of these messages
Yes,
outside.
yes,
Yeah, it
it's
even carries over into the hospital food sometimes.
yeah,
um and it's hard to fight that too. It's hard to fight because I know the American College of Lifestyle Medicine, part of their goal is to reverse that inside the hospitals. um but you have to literally go to the very top and work your way down. So you can't, like, I remember I asked one of them, I tested it out. I went in there and I asked one of the staff members, I said, can you just maybe just put some olive oil and just regular olive oil with no additives, nothing else, right? And they're like, oh, I don't think we can do that. And I was like, I said, it's just olive oil,
yeah.
you know?
It's
Um,
scary. I unfortunately have been spending a lot of time in the hospital. My father-in-law has been suffering from end-stage renal disease. And my stepfather had a massive heart attack last week, and so I've
oh,
witnessed
wow.
firsthand the food choices that patients are given. And you would think that after suffering a massive heart attack, diet would be vitally important. Um, but the food that my stepfather was given was something like you would a 16-year-old would eat on a regular basis, right? Fried
Yeah.
foods and heavy gravies and what have you. And I'm thinking, my goodness, the guy just had a massive heart attack. I think maybe a more appropriate diet is in order here. So no, it's definitely systemic. It's worldwide.
Yeah. 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 It really is. Well, hopefully we can use, this message and then combine it, with other people and really, we have to lobby for it. I think that's one of the
Absolutely.
goals to start. Um, so I'll get you on a plane over to Washington D.C. and
I'm,
get you in that
I'll,
office over there.
I'll pack my bags. Just tell me
Yeah,
when. Let's go.
yeah, exactly.
It's worth it. You know
Well,
what? It's worth fighting for.
it is. It is. Yeah, you're right. You're completely right. It's a staple that we need to um, nail down, basically. Well, I really appreciate you talking with me. This is a great ending. I think it's really shows your what good principles you have and what patients can kind of expect and just how good of an all around person you are.
Appreciate that. Well, thanks
Um,
for having me on. I had a great time,
yeah,
and
maybe we can do a part two sometime.
that would be fantastic.
The Clear Health Podcast is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The use of information on this podcast and materials linked from this podcast is at the user's own risk. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions.